On this episode, we're going to expose an epidemic that greatly impacted all of mankind following World War I. Joining with us this evening, we have Dr. Shi, a historian from Oxford University, Dr. Columbia from Harvard Medical School. Dr. Shi, what is the history behind the Great Flu Epidemic?
Well, the epidemic actually started in the U.S. with a group of infected soldiers. They left for Europe to fight in World War I, and they were carriers of the virus then. And then by 1918, soldiers in most European armies were infected with the disease. And the disease spread very quickly throughout Europe and the United States and the rest of the world. And most of the victims were young, healthy adults. And the deaths ranged, it's about 50 to 100 million worldwide deaths.
Letter carriers, mass transit workers, and others who came in contact with the public were especially vulnerable to disease. Wearing a mask helped them avoid contamination.
How is the virus spread?
As you know, most of the European armies were already infected when this happened, and because they were in such a deadlock with the trench warfare in World War I, and the conditions of the trench just spread the disease even more quickly. And when suppliers would come and soldiers would leave for a little bit of time on break, they'd spread the disease to civilians and civilians to other civilians. And so it just spread rampantly out through Europe and then between Europe and America, and it was just horrible. It spread very, very quickly.
The flu spread rapidly in institutional settings, including military housing where men shared close quarters. This notification of the death of an Army private is one of thousands sent from military bases to families and other government officials.
How did the world recover from it?
Well, the disease eventually died off, and quite literally too. There were hundreds of people dead and dying every day, and the morgues, they were overrun, 10 times the amount of bodies they were normally digging with, and everyone was getting infected. It was really gross.
Dr. D.A. Richardson, a physician visiting a New Mexico pueblo, describes the symptoms and course of treatment for flu victims. The disease progressed erratically. Some patients recovered, having followed the doctor's orders to remain prostrate and have liquids only. Others deteriorated rapidly, contracting pneumonia and dying within days. Officials feared mass hysteria in major cities. Citizens were urged to stay indoors and avoid congested areas. Here, policemen patrol the streets to ensure public safety.
Dr. Columbia, what steps are being taken to prevent the happening again?
The way to prevent influenza is definitely to get a vaccine. They don't cost that much, and they're provided all over the nation. And people who already have immune systems because they have HIV or because they're just older definitely need to get that. Wash your hands. Don't drink after people. Make sure that what you eat is clean and washed, definitely fruits and vegetables. And if you do get sick, make sure that you contact your doctor within 48 hours to get antiviral drugs, because if not, it could lead to dehydration and hospitalization. And so it's really important that you contact your doctor within 48 hours.
The flu interrupted the activities of the United States Food Administration responsible for rationing during World War I. The administration's Wildenburg, Oklahoma office canceled its public meeting because of 300 reported cases of flu in the area. In this letter, a volunteer nurse assigned to various military bases writes to her friend about her experiences. Her initial reaction to death is a window into a personal experience rather than an official report. The first one, officer, that died sure unnerved me. I had to go to the nurse's quarters and cry it out.
What exactly does influenza do to your body?
Influenza is a viral infection that is divided into 3 types by medical professionals. A and B cause respiratory illness, and that's what we saw after World War I, whereas C is a lot more mild and really just causes a fever. What really happens is what makes it so hard to treat is that it's constantly mutating, and so the virus eats the immune system, and the host cell becomes susceptible because it infects the cell, and then the antibodies, conform to what they need to do to stop it, but then it changes, and so you have to have a new antibody, and the old ones aren't really sufficient to hold it back, and so all that changing and mutation just causes it to be really, really hard to fix. Is that okay?
In October of 1918, Congress approved a $1 million budget for the United States Public Health Service to recruit 1,000 medical doctors and over 700 registered nurses. Nurses were scarce as their proximity to and interaction with the disease increased the risk of their death. The flu spread rapidly in institutional settings, including government-operated Indian schools. This notification of a student's pneumonia following influenza is one of thousands sent from Indian schools to next of kin. The Navy Department tried to prevent the spread of influenza by educating sailors about protecting themselves. In Circular No. 1, the Navy's Bureau of Sanitation suggests fresh air, adequate sleep, and fluids to stay healthy.
In adults, it's a fever from 100 to 103 degrees, but in children, it's often higher. Cough, sore throat, runny stuffy nose, headache, muscle ache, fatigue, all these really play a part in how bad your immune system is really just getting attacked.
Because of the federal government's role in administering Indian reservations, the effect of the flu on the Indian populations is well documented. At the Reno agency, an agent took photographs and compiled detailed notes. In this shack, I found 4 people lying on the dirt floor wrapped in rags, apparently all suffering from influenza. The flu was highly contagious and spread rapidly, as documented in a military report notifying the Office Quartermaster General in Washington, D.C. of a staffing crisis. The report notes 11 officers and 1,489 employees absent today, with the situation not improving. Residents of the Western Shoshone Agency received a notice of rules such as keeping the home aired out, and women and children were to stay home, which they were to follow for the duration of the epidemic. The flu prevented day-to-day operations from going smoothly. Officials advised all persons to wear face masks, even indoors. Many believed that a person could contract disease by handling documents and equipment. This notification sent to the parents of a student at an Indian boarding school is typical of many letters on file. Hospital staff handwrote admissions daily to South Beach Hospital. The journal notes that 6 people were admitted on Christmas Day and that John N. Frill was admitted on December 27, 1918 at 5 p.m. and died on January 2, 1919 at 1:25 a.m. Mass transit systems, with crowds of people in close quarters, were fertile venues for the spread of disease. In Seattle, public health officials required passengers and employees wear masks as a precautionary measure.
Thank you so much for viewing our show. Dr. Shee, Dr. Columbia, thank you so much for the relevant information that you have contributed to all of our viewers here in America. Thank you. Good night.